Welcome back. You're still watching It's a Beautiful Day. This is the Weather HQ segment. Now, PAGASA has officially announced the start of the Tag-Init season in the Philippines. Now, as temperatures soar, the increase in heat and humidity can lead to a rise in common diseases. Now, these include heat stroke, dehydration, and respiratory infections, which often spread more easily during the hot weather. Now, to help us understand these health risks better, we're joined via Zoom by Dr. Justin Sinco from the Birth MD QC and Camarin Doctors Hospital. Magandang umaga, Doc Sinco. Thank you so much for joining us on It's a Beautiful Day.
Hi, thank you for having me. It's nice to be here.
Doc, let's start off first with the fact that a lot of people know and understand that there are certain illnesses that are relatively seasonal depending on what the weather is like. Here in the Philippines, when we talk about the Tag-Init season, what diseases typically spike in your experience, or what the data shows that you have to deal with more?
Okay, so during this hot, dry season, usually we get cases of skin problems, mostly sunburns, heat rashes, or we call them bungang araw or prickly heat. There's also cases of heat stroke, very dangerous, and some infectious diseases, like as you've said, the respiratory illnesses, they happen all year long, and skin infections as well, like impetigo or mamaso, and chickenpox, and also currently measles is on the rise, so that's something that we are wary about as well.
Is measles related to the Tag-Init or these higher temperatures?
Well, not really. Probably not, because measles isn't typically related because of the peak into the rising of the temperature.
So let's talk about some of the more heat-related illnesses, or at least afflictions. We mentioned, or at least what's going around in the news more, is about heat stroke in particular, and dehydration, or extreme dehydration, due to the high heat in indices that we're experiencing right now. If I'm not mistaken, around 47 degrees Celsius in Dagupan at the moment. So when you have reports of that with high temperatures, just how much does that increase the likelihood of heat stroke? And of course, how can people at least monitor themselves better when it comes to their own hydration?
Okay, so when we're talking about heat strokes and heat exhaustion in general, it's because of the body's temperature getting too high, and as well as the environment the body is in is already too high, and the body can no longer regulate its own temperature. Generally, so how to avoid that or keep hydrated is, well, first off, you have to keep your environment cool, or if you're working outside, try to work in the shade, wear some protective headgear, some wide-brimmed hats, and keep a water bottle nearby all the time. Generally, we want you to drink at least, maybe, if you're an adult, no, generally for adults, it's 2 liters a day. That's including the fluids you get from soups, from the food stuff that you eat. And if you're sweating, exercising, doing a lot of manual labor, I'd suggest you drink a lot more. So if you're thirsty, you drink water. And a convenient thing to probably carry around is a towel, so that you can wet that towel and keep yourself cool. Like apply the cold packs or the wet towels on your neck, on your armpits, on your groins. That will help lower down your body temperature.
Yeah, you know, you mentioned certain age groups in particular, so I want to focus on that first. When there are certain age groups that are more vulnerable to heat stroke, a lot of people would think of the elderly and the children. Is the spike, or at least is the increase in terms of heat-related illnesses, that much higher in terms of the children and the elderly compared to the regular adults?
Yes, yes. For children especially, children especially less than 1 year old, or the really young ones, the 1 to 2 months old, they're really at risk for heat exhaustion because they still cannot regulate their body temperatures well. That's why we're the ones who actually keep them comfortable. And for the elderly as well, especially if they have comorbidities, which is likely in elderly, usually they have hypertension, they have diabetes, kidney problems, and that will make their bodies more prone to heat strokes because they can't regulate a lot of their body, um, their physiologies are different now,
Yeah.
and they're at risk for a lot of electrolyte imbalances, problems with their blood pressure because of the heat. So that will compound and make heat stroke a lot more likely and a lot more dangerous for them.
Well, Doc, we've heard the tips over and over again with how to deal with extreme temperatures. So when it comes to
Mhm.
staying indoors, staying away from the sun, trying to limit your time
Yeah.
outside, we've heard all of that. I want to focus on one thing that we were talking that you mentioned a while ago, which is the hydration. Because some
Mhm.
people believe that as long as you drink something cool, that's going to be enough. Sometimes juices, sometimes sweet drinks, and perhaps maybe saying that, hey, maybe an electrolyte drink will be good enough instead of just a cup of water. When you hear people talk about that, what is the actual proper way to hydrate, especially during this time?
Okay, I would say there's not really any studies against drinking these electrolyte drinks. You might be, if you find them more palatable than just plain water, I would say it's better that you drink anything or you drink something instead of nothing. So
Mhm.
I would actually encourage these people if you don't like water because I know I usually practice with children. My patients are usually children, and a lot of them hate water. And sometimes I tell the parents, it's better than nothing. So, but the proper way is to have your drinks at hand. Drink it frequently. So
Mhm.
every time when you're out, and especially when you feel thirsty, that's actually your body's way of telling you that, hey, your electrolytes are weird now. It's time for you to fix your body, and then so you drink a cup of water and a glass of water, cold water or warm water, regardless of the temperature, it will help hydrate your body.
I like how you said you have to drink it constantly. So hindi naman pwede na, you mentioned I think 2 liters for an adult per
Mhm.
day. Hindi naman na isang upuan mag 2 liters ka, okay na ako.
Yeah, yes, yes, yes. No, hindi naman 2 liters lalagukin mo, no? So you can drink it like if so 2 liters can be around eight. That's where the 8 glasses a day comes from. So 8 glasses is roughly 200 to 250 ml. So yeah, you can drink a glass of water every 3 hours if you want.
All right, so at least alam natin na i-spread out natin sa buong araw. Doc, thank you so
Yes,
much for
yes.
joining us. For those who want to reach out to you, consult with you, where can they find you?
So I practice at Camarin Doctors Hospital and also at the Birth MD in Fairview.
All right, thank you so much. That is Dr. Justin Sinco of the Birth MD and Camarin Doctors Hospital. Thank you so much for joining us this morning.
Thank you so much for having me.